Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
Got some clicking, popping, seems to get better and worse with tightness in my forearm. If I'm sleep on it wrong or whatever, it seems to have, or I don't even know what I do, but I'll be just doing something actively, move it the wrong way, do something wrong, and all of a sudden it'll start clicking and catching.
It's catching. Do you feel it's catch more in the morning or just random?
It's random, yeah. It depends on what I do, but I mean I can feel it right now.
Okay.
It's kind of tight.
Can you make a fist and try to open? Yeah. Okay. So how much pain from 0 to 10? 10 is emergency room.
Probably right now it's like a 3 or 4.
Okay. Where do you feel it?
In this area right here.
That area? Okay. And that was how much from 0 to 10?
Probably a 4.
4, and it's catching here and here?
So right now it's not catching here. I just feel it here right now.
Okay.
But yeah, I mean, I've moved it a good bit, but it was popping a little bit earlier.
Okay. So have any treatment for this? You said like how many months?
Yeah, I've got some needling done and some other things. Probably 3 or 4 months.
3 or 4 months. So you just have dry needling. See that or something.
I still have some pop in this hand too, so
Yeah.
it may not be good comparative. It's different fingers, but
In the joint too. Yeah.
I feel like pain in the joint, but it is clicking.
Okay.
That muscle tightness.
That's you get a big position here.
I feel it.
You're so funny, girl. You're funny.
Do you do a lot of typing or writing or
A lot of
something?
typing, a lot of writing.
Does it really bother you afterward?
Yeah, it does.
That's the only finger, yeah.
Mm-hmm. On the right side.
So that's very restrictive for sure. The fibrotic tissue is actually around here. You have most of it. It starts to clear up now, but that's usually very typical when you have finger stiffness or trigger finger. Okay, so we just finished working on it. Do you feel it's back to normal, or you still feel tightness?
Yeah, feels really good right now. Feels back to normal.
Yep. Okay. You don't feel any clicking or any stiffness? And
No, they feel good.
okay.
Actually, the other fingers feel like they need to be worked on now too.
Because I did not work on it. Okay.
The middle one feels
compare.
better than the other ones.
So I will work on the other ones, but the problematic finger is feel better.
Yep.
So what's your honest opinion about ASTR? You tried before, like PT, dry needles, chiropractors.
Yeah,
what do you
it's
think?
been amazing. It's really cool how you can kind of see and map out the tissue and see where the issues are.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.